are the critical evaluation issues? So what do you want to obtain when you get answers to these questions? Number one, does the patient have a sexual disorder? And of course, what's the diagnosis if you can make one? This is particularly important because sex is sexy. So quite often you'll have people seeking your assistance for therapy, presenting a sexual problem as a way of getting in the door and capturing your attention in the hope that you will accept them as a patient. So you really want to clarify, is there a sexual disorder or something else going on? Second, and of course I appreciate that for many physicians, it's more of the doorknob kind of situation. As the patient's leaving, having spoken to the cardiologist, oh, by the way, doc, I'm having a little trouble getting it up. Well, what can you do about that? And the consultation is almost over. The person's at the door. By the way, if that happens, what you want to do is just reassure the person that there is help available, but it's a little complicated, and we want to make another appointment to discuss this so that I can really provide the thorough attention to this issue that you deserve. That way you can still stay on schedule for those of you who have sort of tighter, more limited consultation time available to you. The patient is reassured that they're going to be able to get some help, and you can escort them back to the waiting room. Second, what are the key underlying biomedical, psychosocial, and cultural factors that are at play in this situation? The most important to capture initially is what are the immediate maintaining factors? What are the current cognitions, emotions, behaviors, organic, medical, etc., causing on an immediate level to maintain the problem? And then second, you want to get a sense, at least an initial sense, of any deeper mental or physical causes that are emerging, whether they're predisposing or precipitating. And then third, do any of the underlying factors require pre-treatment, or can they be bypassed, modified, or treated concurrently with the sex therapy? So for instance, evaluating the person's level of depression, the degree of marital conflict, whether or not they're addicted to some drug, alcohol, etc.